Hello, everybody. Hi to all of you, my friends and family. First, I'm so sorry for not posting a video in quite some time now. I think the last time I posted one of my videos was back in December. So I just want to apologize to you all. As you know, my schedule is pretty busy. With my kids and working, so sometimes things can get pretty tight, but I am so grateful to be back again, talking to you guys. I hope that everybody is doing well and staying safe. If you are seeing me for the first time, my name is John Jay, and I do have a YouTube channel called Health Talk with John Jay. So I want to welcome you all. Thank you for watching my video. Thank you for all your support. So, if you are in America, some of you may be aware, some of you may not be aware, but every month of focus is paid to certain diseases, pretty much just to create more awareness about the condition, risk factors for those diseases, what to do to protect yourself if you already have it, different steps that you can take. So, February is American Heart Month. So what that means is during the month of February every year in America, more attention and more awareness is paid towards heart disease. So pretty much you will hear maybe from your doctor offices, or you will see on the TV, there will be awareness, more focus being paid to heart disease. You will hear about the risk factors, steps that you can take to save yourself or your loved ones. And heart disease is also known as cardiovascular disease. So cardio simply means your heart. So that's just the medical term for heart disease, is cardiovascular disease. Okay? All right. So I just have my little cheat sheet. I just jot down a few points that I wanted to address with you, to discuss with you guys today. So before moving forward, I think it's important to give a little bit of statistics when it comes to heart disease, because if you are alive, trust me, you have your heart. The heart is very important in the body. All right. If you are breathing, that means your heart is working. So you want to do what you need to do in order to keep it working longer. So according to the CDC, which is the Centers for Disease Control and Prevention in America. So listen to this. One person dies every 36 seconds in America from heart disease. So mind you, this is just America. We're not even talking about outside of America, in Africa, in Europe, and all around the world. Just in America alone, one person dies every 36 seconds from heart disease. And about 659,000 people in the United States die from heart disease each year. So if you put it together, that's 1 in every 4 deaths is from heart disease. So that's why it's important that in this month of February, we pay attention to our heart. Okay, so I'm gonna ask you this question: how are you caring for your heart? How is your heart? Do you know that the main risk factor, the primary risk factor for heart disease is high blood pressure? That is the leading risk factor for heart disease and stroke, is high blood pressure. And I can guarantee you, a lot of us, a lot of people, a lot of Africans, a lot of us Liberians, Ghanaians, wherever you're from, even in this America, African American as a whole, a lot of us are living, a lot of people are living with hypertension. So if you have uncontrolled blood pressure, it is important, or if you've been diagnosed with high blood pressure, or if you've been told, you're on medication already for high blood pressure. Again, the medical term for high blood pressure is hypertension. You have to be careful. Pay attention to your heart. Right? So we see that hypertension is one of the main risk factors. So how are you managing your blood pressure? Is it control or is it out of control? The risk comes about if your blood pressure is uncontrolled, it's not being managed properly. So I'm going to be giving you some few steps that you can take if you are living with high blood pressure. Maybe it's not you, your loved one, your family, friend, whosoever is living with high blood pressure, to help them keep their heart healthy. I'm going to be sharing 5 steps that you can take in order to protect your heart if you have high blood pressure. So the first and most important step is check your blood pressure on a regular basis. So if you go back on my YouTube page or even my videos here on Facebook, you will see that I did a video back in one of my videos where I show you what a blood pressure monitor looks like. And I also demonstrated the proper way of checking your blood pressure. So if you have not seen that video yet, I want to encourage you to go back in my YouTube to my YouTube page. It's called Health Talk with John Jay, and just search for that video and you'll see the proper way. To get a blood pressure monitor, if you are in America, it's not that hard. If you have family or friends in Africa, you can purchase one and send it for them. You do not need a doctor's prescription for it. You can get it over the counter. There are so many different blood pressure monitors out there. The key is knowing how to use it properly, because if you have the equipment and you don't know how to use it properly, it becomes useless. And it can cause misdiagnosing of your blood pressure or underdiagnosing of your blood pressure. So if you have one and you're not sure how to use it, talk to your healthcare provider, and they can ask you. If you don't understand the instructions, please voice it out. It is our responsibility as healthcare providers to make sure that whatever equipment we give you guys, or if we expect you to do something, it's our responsibility to teach you how to properly do it. So don't be afraid. Tell them. Nobody will consider you silly or, don't know what to do. Just voice it out. Don't be afraid. We can help you. Take it step by step. But it's important to check your blood pressure on a regular basis. And then secondly, if you have diabetes, you want to manage your diabetes, because most people living with diabetes also have high blood pressure. Those two go hand in hand. And the primary cause of kidney failure, high blood pressure and diabetes. So if you have diabetes, know that eventually you have high blood pressure too as well if you haven't already been diagnosed with it. So keep those two under control. Next, you want to take your medicine. Take your medicine as prescribed. Do not go treating yourself. One day you decide, I'm not taking the other medicine and I'm not going to tell my doctor anything about it because when I take it, it makes me feel this, that. No. If you have any issues or concern with any medication that the doctor gave you, ask them. Tell them the symptoms you're having. Doctor, you prescribe such and such for me, but every time I take it, I realize my head hurts so bad, or I get sick to my stomach. I feel like I want to vomit. Is there anything you can do? There are so many different options and alternatives out there that the doctors can help you find one that works for you. But never not take your medication on your own because you feel that, it's not right for you. Always talk to your doctor about it. Take your medication exactly as prescribed, and always check your blood pressure before taking the medicine. Because if your blood pressure is already low, if your top number, which is your systolic blood pressure, is already on the lower side, you normally run high. When I say lower side, maybe like 120, 100, and you normally run in like 140s, 150, 160s. Maybe at that moment, hold off on taking that medication in the morning and then recheck in like an hour or two. But again, you always want to go by your doctor recommendation. Don't say, John just said I shouldn't take my blood pressure medicine because my blood pressure is 100. No. Everything I'm discussing here is for information purpose only. Information purpose only. If you have any questions, any concerns, if you have any medical issue, please refer back to your healthcare provider, your doctor, your nurse practitioner, whoever is managing you. I'm just giving this information out. Take your medicine as prescribed. Don't skip your medication. And lifestyle changes. This is the most challenging one for a lot of us. Me here, I'm guilty of the same thing too. Sometimes I will plan, I'm going to exercise 3 days a week, and I will be so motivated. I'll be going to the gym 3 times a week, waking up at 4:30 in the morning, go to the gym, come back, get my kids ready for school, drop them off. And, I will be doing it faithfully. But then after a while, I'm like, maybe I will skip tomorrow. I'm so sleepy, I'm going to skip tomorrow. And then you stop skipping. You aren't there anymore. But lifestyle changes is important. Be physically active. Try to eat right. um Stay away from you want to be physically active, try to eat right. If you have high blood pressure, maybe limit your salt or sodium intake. So if you smoking, you want to work on stopping smoking, cigarette smoking, because all of those are not good for your health or for your blood pressure. And lastly, talk to your healthcare team. You are the most important member on your healthcare team. Do not be afraid of them. Always communicate with your healthcare team. You, your doctor, or your nurse practitioner, dietitian, social worker, always stay in touch with your healthcare team. So to recap, the steps to keeping your heart healthy: number one is taking control of your blood pressure, because hypertension is the leading risk factor for heart disease. Check your blood pressure on a regular basis, manage your diabetes if you have it, take your medicine as prescribed, make some lifestyle changes, and talk to your healthcare team. So, how are you caring for your heart? I leave you with that question, and I hope you will make the best choice. Thank you so much for your time. Bye, and look forward to coming back again. Be blessed and stay safe. Thank you. Bye.